Warning: this content may be upsetting or disturbing to some audiences. This was more frustrating than anything, but we had one patient who had a tendency to chew on and then swallow batteries. Now, a lot of our patient group would repeatedly swallow certain risk items that they weren't supposed to have access to, including tweezers and forks. But this patient was a particular concern as they'd repeatedly been taken to A&E over the issue. It was found that the leaking battery acid was starting to really mess up their stomach and could potentially be fatal, so naturally it became an immediate priority to take additional precaution against it happening again. Fortunately, batteries were extremely difficult to find on the ward as all remotes and such were locked away. In addition, they only had arm's-length supervised access to items that contained any batteries, which had usually been taped inside regardless. However, the patient in question discovered a trick to get around this. This involved going to the toilet, defecating, sorting through their excrement, plucking out the recycled battery, chewing on it, and then swallowing it again to continue to cycle. Once this started happening, the decision was made to lock their bathroom at all times and supervise them whenever they had to use it. So, around that time I was doing my observations on the ward, which basically involved checking in on all of the patients every 5 minutes to make sure they were still alive. The battery swallower was in their room, just sprawled out on their bed with a sheet over their lower half, and reading a book. When I'd open their door they'd smile and nod at me before going back to reading. They'd appeared settled in mood throughout the day, so I wasn't particularly concerned about anything. During one later check, I noticed that they had repositioned themselves so that they were now lying on their side instead of their stomach and facing the door. They also looked a little flustered. I asked them if they were okay and they said they were fine. I didn't have much of a reason to not trust them, plus I had to check everyone else, so I just took their word for it and moved on. As it neared the end of my hour of doing observations, I opened their door and immediately recoiled from the stench. It was atrocious, like someone had bombed an open sewer with mustard gas. The patient was still sat on their bed, but now they were quite red in the face and smiling at me with their eyes opened wide. Naturally, I immediately asked them what in the name of God is that smell? In more professional wording. They tried to respond to me, but their voice came out muffled and incomprehensible, and as I stood there staring at them I realized that their mouth was full and they were trying to swallow something. It was too late to do anything at that point, but it dawned on me that ever since they had moved onto their side on the bed, they'd been trying to poop onto their hands so that they could swallow the battery. It had obviously taken a while to push it out there, and we later found out that they'd just plucked the entire turd out of themselves and stuffed it into their mouth. The worst bit was speaking to them afterwards and having to take in their breath and seeing their teeth. Very awful. Oh, and the battery wasn't even in there, so they'd essentially eaten their own poop for nothing. My wife works in a psych ward and she had a lady recently give birth to tea bags after claiming to be pregnant during her stay. She shoved them up there and acted out a whole birth and everything. When that was all said and done, she spent a few days screaming at the nurses and texts to give her the baby back. She went to a long-term treatment center after that. I'm a nursing student who had my psychiatric/mental health clinical in a mental health crisis center. In all reality it's not really that crazy, it's mostly Baker Acts for people who are severely depressed, or people who are neglecting themselves due to their mental illness. Mental health units have a lot of negative stigma associated with them being for crazies and whatnot, but really they're just sick people trying to get better, just like any other hospital. Even the patients with schizophrenia or psychosis are usually there because their meds got out of whack and they are being rebalanced. That being said, the most crazy and heartbreaking case I dealt with was an 8-year-old child who grew up watching his stepdad abuse his mom, but could not do anything about it, so he would internalize his emotions, leading to self-harm and suicidal ideation that culminated in him stabbing himself through the arm with scissors at school when he was being bullied. Hearing about how he wished he could just end his life at such a young age was absolutely heartbreaking and really put into perspective my problems when compared to this kid, who had gone through more in 8 years emotionally than I have in 20. People being psychotic and even the violence are things you get used to. The extreme incompetence of a large portion of the staff members, and the awesome job the administration did of ignoring it, was absolutely shocking. For the most part it was a mess leading to misdiagnosis, understaffing and mistreatment of patients, but some of them seemed outright malicious. One witch of a nurse would constantly escalate situations to the point of restraints and drugs being used in order to get back at patients who insulted her. I feel I should note that there are several who were absolute pros, whose skills I truly admired. But they could only pick up so much slack. During my several sojourns into inpatient care when I was in my teens and early 20s, there was one male psych nurse assigned to a ward full of female patients between the ages of 16 and 21. You could remain in the youth or juvenile ward until you were 21 because of reasons I don't remember. Patient problems ranged from depression and anxiety disorders to violent psychosis. Substance abuse was common. It was well known among the patients that you could get cigarettes, alcohol, Adderall, and Vicodin from this one nurse in exchange for sexual favors. He was there for years. He was reported on occasion, but those reports never led to any disciplinary action because, well, who would you believe? The disturbed young ladies with a history of mental illness, behavioral problems, and substance abuse, or the clean-cut well-loved psychiatric employee with a squeaky clean record? Nurse guy was way more subtle about this than I make it sound. He wasn't handing out pills like Skittles and getting a dozen blowjobs a day. And he was good at picking victims. And also the facility was understaffed and not well run. I didn't technically work there, it was a clinical rotation for school, but I have a couple stories. So this paranoid patient, who was relatively pleasant, told us that there was a bat in her room. This was an inpatient facility, patients don't typically go outside, and windows don't open easily. She was brushed off. One day during rounds, she repeats that things are going well, but there's a bat in her room. She caught it. Everyone was doubtful, but sure enough, she pulls down her bed sheets and there's a real bat trapped underneath that flies out. Felt real bad that people wrote her off for that, so now I'm very careful with people who claim to have seen or felt things that seem unlikely. I was a rec therapist at a state hospital after college. I worked in what was the aggressive male unit. We had all the murders, child molesters, and aggressive males. On the unit there was a wing that was locked at all times for the patients that needed extra supervision. One guy was actually court committed to this wing. He would take advantage of the week, so he was on a Q15, which was a visual check every 15 minutes. Once they found him in the bathroom during a check buying pee from another patient for $2. He told the staff that he wanted to gain the power and strength of the other patient. Another guy didn't have an XSI diagnosis, only mild mental retardation, but was aggressive at times and really big, so the state sent him to the hospital because there was nowhere else for him. He would love cookies and snacks, but did not have money. He figured out that if he went to the actual hospital they would bring him cookies, snacks, and ginger ale. So he began to swallow things to go to the hospital. If not watched closely, he would pull a clock off the wall and swallow the batteries just to get snacks. After I left the hospital, I read a story in the paper about a patient drinking bleach and dying. So I called an old coworker and they confirmed that the patient swallowed bleach after a janitor left a utility closet door unlocked. I once pulled a toothbrush out of a man's butt as he yelled, "F my vagina," at the top of his lungs. I have so many stories about that place. I miss working there. It was hands down the most fun I ever had at a job. All the patients loved me because I was the guy that would hang out with them and take them out of the hospital on field trips. My friend told me this one. She works at the mental hospital in my country that gets the most challenging teenage patients. They got this 12-year-old girl who broke her own thigh bone in her room during the third night. Imagine the willpower with that one. Obviously it became a huge deal because that shouldn't have been able to happen. I don't know the details, because my friend was so shocked about this. She was just out of school when this happened. I felt like she wasn't exactly ready for her work yet, but she wouldn't really talk about it, not that she's allowed to anyway. But what I gathered once when she was really drunk was that the girl just dropped something really heavy repeatedly on the thigh when the thigh was above the air and the rest of the leg was on something solid like a table. I don't know if this is the case 100% and what are the details, but that's the imagine I got. She won't talk about it, so that's all I know. But wouldn't the leg just move or snap from the knee? I really don't know, but it was a thigh bone that she broke. Her dad had broken her leg and arm before, burned her to the stove and done all kinds of absolutely terrible stuff. Maybe she was used to the pain by then. I don't even want to tell about the absolutely evil stuff her dad did. I really don't know how a person can do that to themselves, but maybe her childhood explains it, and I know I shouldn't know about this, because my friend is a nurse, but she really needed a person who would listen about all that terrible stuff she saw. While I was doing clinicals, nothing terribly exciting happened, because we were kept in the safest unit. But one of the longer-term staff there told us about a girl who was in her room and rubbed holes into both forearms to commit suicide. He had even taken pictures, which were super raunchy though badly lit, but this girl had rubbed the skin and veins in her arm down to the bone. Obviously she died. Not an employee but someone who had to be placed into a unit for about 3 months as a teenager. We had some free time scheduled in for a few hours every day. Most of us were just depressed, suicidal or had eating disorders. There was one girl who had been abused as a child and she had been there for a couple years. She was very odd. One day there was a lot of screaming from the common room and a bunch of orderlies had to pin her down on the floor. She had bitten off her finger and then went all Mike Tyson and bit a chunk off one of the orderlies' ears. I am happy to say that I was moved very shortly after. I worked in a locked unit for a few months. I've been bitten, scratched, punched, spit on, had my glasses punched off my face and vaginal fluids and vomit thrown on me, the list goes on. But my worst memories are a toss-up between a guy staring me dead in the eye and slit his wrist with a big plastic pen. Or seeing a girl swallow a rubber glove, ice pack, rocks, used tampon, feces, and an MP3 player. One morning, a new admission needed to give a urine sample. During her assessment she seemed relatively aware of things so nobody thought she'd have difficulty with it. So, I gave her the cup and explained I needed a urine sample. She stared at me blankly. I repeated myself, and when I got no response, I explained I needed to stay in the bathroom to make sure it was a genuine sample, the urine was her own. I turned to give her privacy. The next thing I know, I heard the sink running. She was trying to fill the cup with water. I re-explained exactly what I needed from her. She stared blankly. Mind you, I'm trying to put it as simply as possible at this point. I turned back around to give her privacy. Next thing I know, she's naked in the shower. I re-explain what I need, and after 15 minutes of this, she complied. I left her in the bathroom and delivered the urine sample to the RN. I was then on assignment of watching a male patient, whose room was next to that particular bathroom. I hear the bathroom door open but I don't think anything of it. I start to feel uncomfortable but I can't place why exactly. I happen to turn around to find the female patient from before standing directly behind me, completely naked, staring me down. I avert my eyes and explain she needs to return to the bathroom and put on her clothes. She stares silently, makes an almost unbreakable eye contact with me, and starts rubbing lotion on her breasts. I explain to her again I need her in her bedroom or the bathroom and call for the nurse. The patient goes in her room as the nurse comes over. When the nurse knocks on her door, the patient comes out fully clothed and stated she had no idea what anybody was talking about. Psychotic patients sure are fun. So I was on surgery when this happened but we had a patient who was known to our hospital for sticking light bulbs up his butt when he got stressed. Lots of psych issues obviously. Go figure, he was back because he'd done it again, so I was familiarizing myself with his case and going through old notes. He's probably had 6 or 7 removals at this point, and every single case report, the surgeon documented the type or model of light bulb. I don't know why, but that just amused me beyond belief. Psychiatric registered nurse here. Not the craziest, but something I'll never forget. We had this one patient who was legitimately born of incest. She had a huge alien head, patchy red hair like Chuck's, and weirdly shaped toes. When she didn't get her way, she would come up to the nurse's station with blood trickling out of her mouth. I'd say, "What is it?" And she'd say, "I did this." And proceed to show me where she ripped her entire fingernails off before taking another one, biting it off, and eating it in front of me. She did this so much I would finally just watch in boredom, eating my lunch, as she chowed down on her crunchy toenails in the medicine administration window. Not a worker, but I was institutionalized as a kid. There are few things that have stayed with me. My roommate was getting discharged, and her mom snuck her in a lighter. She tied a string to the lighter and hid it inside her vagina for a few days, because she said she wanted to smoke as soon as she got out. In reality, she would need to go somewhere to get cigarettes anyway. I think it just gave her a good feeling to have something contraband on her after being locked up for so long. Another girl I was in with carved, and I mean carved the word witch into the entirety of her forearm. I remember how the scars would catch the light. This particular gal would often receive the booty juice, as they say, a tranquilizer shot to the butt cheek. Literally every day in morning group, this one staff member would make a point of saying how disgusting it was to put underwear in the dirty clothespins in our rooms if they had any blood on them. She said, every single day, that it smelled bad, we were gross, etc., and we were required to notify a staff member if we had leaked on our underwear at all. It might not sound that weird, but she just made such a point of shaming us, and this is an example that stands out in my mind, among others. This lady was incredibly horrible and abusive. Her name was Candace. I remember her well, because during my first skin check, she cornered me in a bathroom, no cameras, and physically ripped my clothes off. I was 14 years old and she was the first person to ever see me naked, and it was against my will. It was incredibly traumatizing. I'm in my 20s now, a senior in college, and I still want to cry when I think about it. What a horrible thing to put mentally ill teenage girls through. I know I wasn't the only one. I left the hospital in considerably worse shape than I was when I came there, and I don't know anyone who has been there who wouldn't say the same.